When Caden was about 8 years old, I took a picture of him being goofy in our kitchen. And, I noticed a little bit of indentation in his chest and really just kind of blew it off because I thought it's very, very slight. He's just a skinny little boy. Over the next year, he really started getting tall and it became much more noticeable very quickly. His t-shirts would fall down in his chest if he stood up straight. So he started slumping over when he walked. He would start wearing hoodies every single day, whether it's hot or cold. He didn't want to take his shirt off when swimming on vacation. He became super self-conscious about it right around the age of 13. We had a very experienced pediatrician that immediately looked at him and knew exactly what it was. He had us the appointment at Children's with Dr. Dassinger within a week.
There are two types of what we call chest wall deformities. One in which the breastbone grows in or sinks, and that's called pectus excavatum. The other is called pectus coronatum, and that's where the breastbone grows out. Some people may say pigeon chest. Pectus excavatum is the more common of the two. They tend to get deeper during periods of rapid growth in and around puberty. There has been a little bit of a label as a cosmetic operation. However, having done it on, enough kids now, they almost all will tell you their breathing's improved. The other component of it is self-image. There have been studies that have shown documented improvement in self-image after the procedure is performed. So I really don't view the procedure as cosmetic.
We talked about having the surgery. My son absolutely wanted it. He said, I want it done as quickly as possible. I told him, you're going to have to give up baseball for the summer, maybe even the fall. He said, I don't care. I want it done.
That procedure is called the Nuss procedure, which is a minimally invasive procedure in which we make small incisions on either side of the chest. We create a tunnel that goes just behind the breastbone, and we put a bar in place. That bar is shaped a little bit like this. It lifts the breastbone. That bar stays in for 3 years and it corrects the defect.
When we actually arrived at Children's Hospital, everything was great. All the staff were great. Dr. Dassinger has such a great bedside manner. He kept us updated every bit of the way, finding out what was going on, how the surgery went. They did an excellent job assuring us that everything was fine.
The typical post-operative stay in the hospital is now about 2 days. They're then seen 2 to 3 times during that first year, and then once a year after that until the bar comes out at year 3.
So here it is, 18 months after the surgery. He's pretty much resumed completely a full normal life. When he gets done in another 18 months and has the bar removed, he should never have any problems with it, and he can do exactly what he wants to do. He is thrilled with the results. He stands up straight now, walks proud, and has far more confidence than he ever had.